I'm not a doctor. I'm not a medical doctor. I am not a psychologist. That's okay. The law says you have to act reasonable. You have to act reasonable, law enforcement officer. We trust your judgment to interpret. Law enforcement officers have to make reasonable decisions in everything they do when it comes to the powers of their authority. Taking people into custody. Criminal charges, this particular charge, they have to act reasonable. Okay? And a conjunction word that says you also got to do number 2. Number 2 says the person poses an immediate substantial likelihood of harm. Well, what does that mean? Well, the Tennessee legislators way back when says, we might better explain what that means. Because the law enforcement officers say, I can be able to determine under reasonable circumstances whether or not I have a person to believe that has a mental illness. But then I also have to have number 2. Number 2 says substantial likelihood of harm. What does that mean? The legislators created something. Now, as you're reading up there, notice after each point, there is a word that says or. So if number 1 doesn't work out for you, law enforcement officers, try number 2. If number 2 don't work, try number 3. If number 3 don't work, try number 4. Do you see the statutory authority that law enforcement officers can act? When they bring this together and they take somebody's liberty because of the statutes that before them, they say you're having to go for an evaluation. Again, I'm not going to show you all the Tennessee law. There's other multiple layers of protection. Rights are very important to all citizens. So there has to be multiple layers of protections with regards to civil liberty issues of taking somebody into custody. That's what law enforcement officer does. But the important thing is as a law enforcement officer, I have the statutory authority to do something. If you notice in this particular laws, no mention of the information of schizophrenia or bipolar or major depression. So you don't have to be at an educational level of knowing all that. You have to make a reasonable interpretation. Now that comes from a lot of facts and putting the pieces of the puzzle together to be able to collectively come up with a reasonable disposition. But that's something that the Alabama officers of 1990 says, we don't have that statutory authority. And I said, what do you do? Well, we can call a probate judge. Well, how's that working out for you? Well, we don't call him after 10 o'clock at night. That can be frustrating for an officer that works at 12 midnight or 2 a.m. in the morning. What do you do, law enforcement officers, that you don't have the statutory authority to take a person into custody? We put that person in jail. Now, remember, I just told you they were angry because they were seeing themselves putting people that they knew should not be in jail because they felt at a disadvantage. Now, I'm going to be talking. You're going to see some slides. You're smart enough people from Alabama to read the slides, and you're going to say, oh, okay, yeah, I can figure that out. I don't need to explain every slide. I can talk about other things, and that way I get a 2-hour presentation into 1 hour. So it kind of works. You read my PowerPoint slides, and I'll do some talking. And occasionally I'll hit on some of the subject matters. So it really is about working. You as a community or representing communities, you work within those partnerships to make things happen. I've already underscored the fact that CIT is a community program. So, can CIT be defined? Well, yes, no, maybe, I'm not really sure. Is it a roadblock or is it a starting point? I would suggest to you defining CIT is important for your community. For those people in those programs in their community only define CIT as training, I'm saying, wait a minute, you're missing the more. And what's the more? I'm going to be getting to some of the more things. So when you're talking to different people, Sam says CIT is red. And Mary says, no, it's not. No, it's not red. At least it's not that red. And John says, no, you're both wrong. It's not red at all. It's blue. And again, you have different interpretations of what CIT is about, and you have to work through that because every community is not different. You have a lot of rural communities and you have a lot of urban communities, and sometimes they are so different that you have to work through those differences in order to accomplish many of the things more than just training. So understanding CIT, also corrections too. Corrections can be introduced into, CIT can be introduced into corrections with regards to services, because there are times that criminal laws are going to say we have to address, law enforcement is going to have to address those felony laws and those serious misdemeanor laws. Again, a lot of individuals are committing minor that the community says, we don't really want that person to be incarcerated, even for a short period of time. We want you to help people. That's what family members want. That's what the community wants. Again, the people in North Alabama in 1990, that was part of their anger. We're putting people in jail that we know shouldn't be there. It's already heard. You don't need me to tell you that. I've gone around the country all over, and I said, I'd like to find a sheriff within the many counties across the United States, and I'd say, Sheriff, do you have people that are in your jail that shouldn't be there, that have a mental illness? And you're not going to find one to say, well, no, all the people in our jail, they whether they have mental illness or not, they should be there. And I would suggest to you there are people in jail, as you know, that should not be there. So what is CIT? One of the simple definition of that is all about safety. It's safety for the officers, safety for the family members, and safety for people who live and struggle with mental illness. That was at the foundation of our leadership back in 1987, addressing the issues. It had to be about safety. Now, we'll talk about that as we move on. In fact, we'll talk about it now. There's two headlines that I want to bring your attention to. One was a headline in 1987, and one was a headline in year 2000. And you can see by the headline that if you're a law enforcement administrator, or if you are an elected official of a community, or you're a citizen of a community, and you walk out to pick up the morning paper, which headline would you prefer to read? And I would suggest, and the headline of 2000 is a very positive reflection of the community doing something, as opposed to the headline that was introduced in 1987. 1987, the Memphis Police Department received a crisis call event from family members and says, please help. Our loved one is cutting himself with a large knife. He's threatening family members, and neighbors are starting to come on the scene. Several officers were dispatched to that particular call event after a brief encounter with this individual who was shot and killed, and it created a community uproar, as the headlines would suggest. It was very concerning. A lot of investigations went on, and the officers were actually cleared. But just because you're cleared does not mean that the community was not in pain. The community's in pain under these things with regards to it. The communities were saying, couldn't you have done better? Couldn't you have done better? That's a pretty tough answer. Pretty tough question to answer sometimes. Well, maybe, I don't know. We're not sure. I don't know. Anyway, it became to the political arena, addressing the concerns of 1987. I've got, real quickly, go back to 1986. This is very, very important to listen to the words I'm about to say. 1986, our family members got together. Remember now, at a crisis event, you have three groups of people. You have law enforcement, you have the person who has a mental illness in crisis, and you have their family members, okay, for the most part. You have three individuals. And so what the family members were seeing is that the officers didn't know what they were doing. They were concerned, and many times, even to this day, across this great country that we have family members hesitating to call law enforcement. I'm not sure what's going to happen when I call law enforcement. Maybe it'll get better. And crises don't just get better, it gets worse. And so by the time law enforcement gets there, wow, that's pretty tough to deal with. We'd prefer to be at the front end of a crisis, but even on the front end, many places saying we're afraid what's going to happen when law enforcement gets here. And if they go to jail every time, that's pretty discouraging with regards to them. Or, well, we can't do anything. We don't have the statutory authority to do anything. You've got to go down and wake up the probate judge and see what you can do with a petition. Well, how long does that take? Well, we don't really know, but it takes a long time. Anyway, my point was that in 1986, the NAMI members of the Memphis started an active campaign, and their message was, your officers are not trained. Now, that gets attention to law enforcement administrators, to sheriffs and chiefs. If somebody comes in and says your officers are not trained, trust me, that gets their attention. So, that particular occasion, they met with the chief, and they said, your officers are not trained. The chief calls the training academy, and they said, I got people complaining that our officers are not trained with regards to mental illness. Report back to me what you're training. And then he picks up the phone and calls a research office and says, I want you to investigate what other law enforcement officers are doing across the country, law enforcement agencies with regards to training law enforcement officers. Because, again, the message was your officers are not trained. So the first report came back from the training academy. The training academy was providing 8 hours of mental health training. Well, that was pretty significant, 8 hours. And remember, this is 1986, 8 hours. And the training was by professional mental health people. The police department had contracted with one of the large mental health centers, and they had those professional people to come out and teach the 8 hours. Pretty good, all right? 30 communities were examined. Law enforcement from those other 30 communities, some larger, some same size, many smaller than the Memphis size. They were coming back. Memphis 8 hours was significant towards the high end of training hours. It was not the highest, but it was up there towards the highest. There was actually one agency that said, well, we don't train any of our officers towards mental illness. 1986, okay? So from the concern, your officers are not trained, the paper says we are trained. 8 hours of professional mental health people training. Well, wow. So anyway, the administrator says, we'll continue to look at this, we'll continue to study this, and we'll get back with you. In case you don't know what that means, come to me afterwards and I'll tell you what that means. You know what that means. Smart people here in Alabama. Anyway, again, that's not that the people were bad. We were looking at the facts. The facts said 8 hours in a scale of 30 other communities. We were on a high scale. You're just wrong, family members, but we're there. We're seeing this. You're still wrong. We have 8 hours of training by professional mental health people. Does that mean that NAMI members were wrong? Absolutely not. Again, it's more than just training. A lot of times, NAMI is good about this. They make sure that you understand the word and the power of a word that's called stigma. Actually, I don't like that word. I think it's prejudice, but we don't like saying that word. But they use the word stigma, and I'm here to say that stigma, prejudice of the past is powerful. It's powerful. And you just don't come in and change that power with magical formula of training. It has to be, you have to change the hearts of people. And I wish that I had a magical formula to say, wait till I change your heart. The next 10 minutes, I'm going to give you some training and your hearts are going to be changed. I wish it was that so. Maybe in the future we can have training that change hearts. But right now we're in a battle of stigma and prejudice of mental illness, past, present, and if we're not careful, to the future too. It has to be addressed. All right. So here's a statement that was made in International Association of Chiefs of Police article, 1999. Thank you very much, Donald Turnbaugh of NAMI, Pinellas County, that hit it right. This unique partnership of police, mental health provides and advocacy is more than just training. Thank you, Donald, for saying that. It can change the way society